To think it's going on when we've got so much in medicine. And we can't save women in labour. You can't help being upset to see a woman, a beautiful woman, dying for nothing. He was the superintendent of a big hospital in Sydney, and I was working there as an intern. We went to a hotel and had a meal together. So that's when I first started to go out with him. And then we got married after about 6 months. We answered an advertisement in the Lancet Medical Journal, which is a very prestigious English medical journal, and it said, Ethiopia wants a doctor, a gynecologist, for Addis Ababa, and to train midwives. We wanted to go somewhere where we could do some good for somebody without enough doctors, some country. We saw this one and we said, well, why don't we apply for this? We were in the army hospital and we used to get the frozen plasma from the Red Cross in Sydney. We had no blood bank in the country, so we'd get a woman might come in bleeding to death. We had nothing to give her, so this plasma was life-saving. We started the hospital in 1974, and when we first opened, we had just simple beds, and just staff doing around. We're just talking to a patient. I would just hug them and try to say a few words in Amharic to them, and Reg would do a great scene. He used to tell them what was going to happen when they're cured, that they were going to go to their village and people would be looking out from their homes and saying, who's this beautiful girl coming up the hill? And then find out that it's their daughter coming back cured. They loved him. I don't know what I love about Ethiopia, but I love the people and I love the scenery and I love the simplicity of life here. I'd like to see our hospital turn into a maternity hospital. I won't see it, I'm afraid, but we could eradicate fistulas if we had enough doctors. The government's given us 3 rooms out of every health centre that they set up, and also we've got our fistula centres working hard in the countryside. Our midwives now are doing good work. They're really making a difference. We have to get rid of this fistula.